Hi there, I'm Dr. Chung and welcome to your friendly proctologist. Thank you so much for joining me today. If you've got a second, can you just move your finger or your cursor below this screen and click that like button and that subscribe button. And we're reaching so many people with this channel thanks to your help, and I really appreciate it. My goal is to give helpful, useful, and real information to everyone in the world so that I can help you with your issues. A lot of you have been commenting, and I thank you for taking the time to write to me. I really read through each comment and I reply to as many as I can. I know you have pressing issues, pain, discomfort, anxieties. I understand that. And I want to give you helpful information, but understand that I cannot see you, nor do I know anything about your medical history. So giving medical recommendations, treatments, suggestions, and things like that are very hard for me to do, because if it's not the right diagnosis, especially if it's not the right diagnosis, the treatments may not be helpful at all, nor would I be able to really think of a suggestion when I don't know exactly what's going on. So I try my best with the comments, but please understand that, yes, the answers sometimes, they do suck. They're not very good, but unfortunately, I'm very limited by what I can do. Let's go to the topic for today. And the question is, on an MRI, they saw a fistula. Do I need surgery? And I think this is an excellent, let's say it one more time, excellent question. Why? Because it's not on the internet and you won't find good answers about this, okay? Let's put the question in another way. Let's be more broad, okay? If I have an anal fistula, do I need surgery? Question mark. And this question is a really good one. Again, I don't have easy answers for these questions, but I may be shaking up the entire world here by my response today. So let's go over that. If I have an anal fistula, do I need surgery? Okay, so let's do some recapping. Let's break this question down because we want to understand it all before we think about and understand the answer. Anal fistula, what is it? An anal fistula is a tunnel that connects the inside of your anus, and the fistula always starts from an anal gland in the anus. That tunnel travels through, may make its way through the anal muscles in some fashion, and then it ends usually at the outside skin of your anus, right? So it's like another hole just outside the anus hole. And usually this hole is very small. Not all anal fistulas even have a hole, but we're just going to talk about this special situation because if we talk about every single one, it's going to get confusing. So we're going to take the situation that you have a hole on the outside of your skin, and usually what comes out of the hole, some spots of blood, maybe yellow, thick stuff, maybe yellow clear stuff, maybe just clear watery type of liquid, all kinds of interesting things. Sometimes you may even see like little poop particles coming from it. All of those are typical and normal for this, right? And the anal fistula got its start from an infection in the anal gland inside of your anus. The anal glands, if you recall, produce mucus as their daily job. And for some reason, they got clogged up like a pimple does, and then it started to expand because it's backing up, and then that got infected, caused a pocket of pus, which eventually was drained out. And in the healing process, something just did not go right, because now you have this tunnel of scar containing bacteria inside that connect these two places from the inside of your anus to the outside skin. And so 50% get the anal fistula, but we don't understand who gets lucky and heals it perfectly and who is in the other 50 and get the fistula, right? Okay, so now we've covered that part. Now, what about, do I need surgery? What kind of surgery am I talking about? This is where it starts to get a little bit complicated, all right? And I'm going to qualify this question for someone, I'm just being very specific here because anal fistula is very broad and complex. The type of person I'm using for this question is someone who has this hole on the outside of their butt for a long, long time. It has stayed stable, meaning that it hasn't caused them any pain. They have the usual drainage, but they go on living every day knowing that they've got something down there, but it doesn't get in the way of their lives. And it doesn't, cause any reason for them to go see a doctor, because it just hasn't really been a top priority because it's been the same for years and years, okay? And the type of surgery for this type of fistula would be to try and get rid of the fistula or cure it, right? Or resolve the fistula. There's so many ways of saying let the fistula be gone, okay? And so let's put this question together. If you are the type of patient that has had a stable and uncomplicated, meaning no infections, no other problems other than the hole on the outside, if that's the type of patient you are that's had this for years on end, like we're talking 5, 10 years, do I need surgery? Do I need a treatment done to get rid of the fistula if you are that type of patient? And my answer would be no. Now, I may have just shook your world because on the internet, if you look up anal fistula, the recommendation is surgery. Everyone should have surgery for their anal fistula. And in my training as well, and in all my books and everything I've read, anal fistula, treatment, surgery. And let's put that answer into context though, because they're not saying that if you don't have surgery for your anal fistula, you're going to die. If you don't have surgery for your anal fistula, this is going to turn into something horrendous like cancer. What they mean is that if you want the anal fistula gone, or you want to have treatment for it to deal with it, the only way to get any result from a treatment is with surgery. We know that antibiotics do not make fistulas go away. Fasting or eating less do not make fistulas go away. Neosporin in there, steroids, whatever creams you want to put in there, the fistula will still stay there. Even if you try to stitch the hole closed, put a saran wrap over it, put duct tape over that hole, it's not going to go away. And so that is what the context is there. Now, why do I say no, you don't need surgery? Okay? The reasoning for that is I have patients that have come in who have had that situation where they say, doctor, hey, I finally got the courage to come in and see you, okay? And let me tell you a story. 10 years ago, I had a little pain pimple on my butt, and then it just burst by itself. And then, ever since then, I have this strange hole, and it like drains a little bit of liquid, or it does that. And sometimes I put a little gauze or tissue there when it gets bad. But it's been that way for 10 years. What is it, doc? What do I need to do? Is it bad? And I'll look at it, I'll say, sir, you have an anal fistula. And they'll ask, do I need something done? And I'll tell them, you have options. If you want this fistula gone, I can provide you with the surgical treatment. The other option, however, is to just leave it alone. And why would I say something like that, okay? especially when everything on the internet and all the literature says you should do surgery. Well, to me, I'm more of a quality of life type of person. And the alternatives here, meaning the surgeries, are they perfect? No, they're not. There are risks with anal fistula surgery. When we talk about anal fistulas and the anus muscles, those usually can be in the way when you're doing the surgery. And so depending on the anatomy of your fistula and how complicated it may be, etc., there's risks of possible incontinence in the future, depending on all these conditions, right? The other thing is you can have recurrence of your fistula. Okay, it can come back, or infections can come back. And so you may need repeat surgeries, or this fistula may show up again because of a failure of a surgery, or you get another clogged up gland right next to it, which we can't predict or prevent. And so when I consider those things, and you have a patient standing in front of me who says, hey, 10 years, it doesn't bother me. I go to work every day, I see my kids, my family, I go on vacation, versus that patient taking upon himself to go to surgery, possibly get another fistula or need another surgery, or having to stress out about the treatments and recovery. It makes me think, like, what's going on here? This takes some critical thinking here. Does this patient really need the surgery? Is this someone where I say, yes, sir, you need surgery? And in my opinion, I think that is incorrect. So what do? What I do is I present everything to the patient. I tell him, hey, you're doing pretty good. And your fistula, stable, uncomplicated. And the other alternative is, hey, I can also offer you a surgery. But this is what comes with surgery. There's no 100% guarantees. But what's the catcher question, right? What is that critical question I always ask my patients to think about? That question is, sir, is your fistula bothering you so much? Or is your fistula causing you to lower your quality of life? Are the symptoms from your fistula ruining your life, getting in the way of things that you need to do? If that is not the case and you're completely fine with it, I would say that surgery probably is not necessary. If the fistula is bothering you and lowering your quality of life, then it's probably worth the discussion and thinking about the surgery. And so when I tell the patients that, most of them just say, oh, I don't need anything done? I can keep going like this? I say, yes, you can. And they say, well, what are the risks then? Is that it? Is there any catch to that? And I'll tell them there are two things. Three. So the first thing is there can be infections in the future. If that hole were to one day close up, then the pocket of pus can come back and you may have pain, swelling, and if it doesn't burst on its own, then you'll need a doctor to help you open it. So if you feel that pain, then you should show up to me or anywhere you are where there's a doctor who can help you to do that, a specialist. That's one thing that may be a negative. Number two negative is that sometimes these fistulas, we usually think of them as one tunnel. There is two openings and there's no other side roads. It's a direct shot. But when things get more complicated, sometimes the infection may draw another road from that main highway. And it can go in either direction. It can be multiple. And so that can become more complicated because you have more tunnels and more places where that infection is spreading. Okay? That is not very common. I will tell you that. And so usually the more straightforward ones are just one road. But you'll know if things get more complicated because you'll start to feel more swelling. Infections show up, other parts of your butt that haven't shown up before. Something will tell you that something is not feeling good, and you should definitely see someone, a specialist like me, if that were to come about. The third thing is cancer, but I'll tell you it's extremely rare. It's less than 1% for a fistula to come from a fistula. And so when you think about all these things, the patient is a very, if you are someone who understands and feels their body and knows what's going on, then I think taking surgery, taking that option of surgery or the option of just living as is, that becomes a personal decision for that person. And I do not believe that convincing someone, telling someone that you have to have surgery for every patient with an anal fistula is incorrect. I believe that, again, I think that medicine and treatment needs to be customized. Patient has a goal, patient has a story, and then you combine them with the diagnosis and treatments, and you get a good picture and a great plan for that patient so that they can live their life and I don't have to negatively impact things, Obviously, if it was something dangerous, we need to do something. I need to let that patient know. But even still, for example, someone with cancer, right? They have the choice as to whether they want treatment or not. And so I will heavily recommend treatment for someone with cancer, but in the end, that person needs to decide for themselves, what do they want? What are their goals? How can we achieve their goals? And that is always my goal. Sorry for the really long video. I'm really passionate about this stuff. I love just meeting people and hearing their stories so I can come up with that plan. It's just, I don't know, it makes me, I think it makes me feel good because the patients feel heard and they understand things so well. It just, the world makes sense. Medicine makes sense when you make it personalized. It's amazing. Anyway, thank you so much for listening. I really appreciate you, really do. Have a great weekend, and I hope you are dealing the best you can. Take care. Bye-bye.